I'm Reena Sharma. I'm a metabolic adult clinician or adult metabolic consultant at Salford Hospital in Greater Manchester in the UK. And I have been in this rare disease field for last more than 15 years, and that includes lysosomal storage diseases as well as other rare genetic metabolic diseases. As a part of my clinical role, I look after and care for these patients and monitor therapies, start therapies, and not only just clinical care. I also manage lots of clinical trials, and over the years have been part of lots of phase 1, phase 2, and phase 3 clinical trials, including in lysosomal storage diseases. Gaucher, especially type 1, including type 3, there are rare diseases. And quite a few patients get diagnosed later in life as well, in addition to the patients who get transitioned from the pediatric service to adult. And we are seeing more and more Gaucher disease type 1 patients diagnosed at the age of 70, 60, 50 now than we did ever before. And as you can see in the Gaucher disease in the current landscape, there are options of various therapies. So patients have got a choices for enzyme replacement therapy. In addition to that, there are also substrate reduction therapies. So there are choices of therapies in this field for the patients. I think that's a very interesting question. And the reason we are still seeing, or we see later onset patients, one is because it's not part of newborn screening. So particularly in the UK, patients are not screened as they are born for this particular enzyme deficiency. And the patients who are presenting later on, what they have is what we call attenuated disease. So they don't have a complete lack of enzyme or very low level of enzyme activity, but they do have some residual enzyme activity. As a result of that, they do not have symptoms much earlier on in life, but they present later on. And the presentation is mainly with the either finding with the complications of the bones, like a vascular necrosis of hips, or incidental finding of splenomegaly and low platelet. In the last few adult patients that I have seen, they were diagnosed following the finding of low platelets, splenomegaly, and then the enzyme was checked and the genetics were checked and they got the confirmed diagnosis. But prior to that, I had quite a few patients who presented with a hip disease or bone disease, and that's how they got diagnosed. So FLT201 is a quite a unique product. As you probably will know, a lot of gene therapies, there is a vector involved, and the vector is a capsid which carries the transgene that we want to introduce into the cells. So the capsid in FLT201 is AAVS3 capsid. And this capsid has got liver specific properties. So it's liver affinity for hepatic cells. As a result, you do not really need to give a lot of it. And it creates enough response that you would expect it to give. The capsid carries a transgene called GBA85. This transgene encodes for GCase85. So GCase85 differs from the wild GCase, which is the enzyme deficient in Gaucher disease, by a couple of amino acids. And this variant GCase85, has got much more availability and longevity in the blood as well as in the lysosomes at low pH. So in the blood, it's available more than 6 times, and in the lysosome, it's available approximately 20 times more than the GCase, which is a wild type. And as a result of this unique two properties of the capsid as well as the GCase85, you need to give very small dose of the therapy to induce the response that you are expecting. And if you think about the trial itself, it was a dose escalating trial, but we didn't actually need to go above the initial dose, and we got enough response, and that was down to the properties that this unique to this GLT 201. But what we presented in the world is the phase 1 trial result for this product, which was a first in human trial. The aims of the trial were dose finding and also look at the safety and efficacy in the areas of interest. So we recruited 6 patients, both male and female. They were all adults because it was an adult trial. And all the patients received a fixed dose of this particular product as an infusion at a dose of 4.5 10 to the power 9 VG per kilogram per body weight, and the patients received as an infusion. As you would expect, patients showed good response, and not just initially that was a good response, it remained sustained as well. But one patient in this cohort had antibodies against the capsid. It was a low-level antibody, and because it was below the threshold for the inclusion criteria, but the patient was still included in the clinical trial, and that particular patient didn't show the response of or expression of GCase85, but all other patients showed good response, and it showed in the clinical outcome as well. So if you look at the lyso-Gb1, which is one of the biochemical marker for this disease, all the patients who had raised lyso-Gb1 at baseline, it dropped very significantly, very quickly in the first 4 weeks, and it remained stable throughout the follow-up period. The one patient who had normal levels remained maintained throughout the study follow-up period. 4 out of 5 patients managed to come off their enzyme replacement therapy or substrate reduction therapy after 4 to 11 weeks of having this infusion with FLT201. And to date, we have got data up to 17 months post-infusion follow-up and up to 14 months after starting their ERT and SRT in this group of patients, and they still show a sustained and maintained response to the therapy. So I think we are quite excited that it has shown good response, and not just in lyso-Gb1, we have shown response in the improvement or stability of hemoglobin and improvement in stability of platelets as well. More importantly, it's also important to note that all the patients except one who were included in this clinical trial had raised lyso-Gb1, which is a very good validated biomarker for the disease burden as well as response to therapy. And I think it just kind of highlights that the current therapies are good. They do address a lot of issues and health issues in this patient, but there's still unmet needs. And I think this what FLT201 promises is a better therapy and more option for the therapy for the patients with GB1. And not just a better with expectation of better outcome, also reducing the burden of the treatment. So if you are on an ERT or an SRT, it's a lifelong therapy, and that's a burden on the patients. So FLT201 certainly promises that it could be a sustainable treatment and good treatment for these patients, and promises to offer a good outcome. And this trial actually supports that the product should be further investigated into next phase of the study, so that we can further validate the outcomes in more future studies.